So, welcome everyone to our monthly HealthTech panel discussions. So, as our readers and viewers know, that ever since the pandemic began, we've been having these panel discussions with the experts, where they tell you about their area of expertise every month. And we also had our HealthTech event last year. We'll also have that shortly, hopefully. So I think we have covered quite a range of topics. So this time we will be looking at the status of the Ayushman Bharat Yojana. Now, all of you must be knowing that the Ayushman Bharat Yojana was launched in 2018 to cater to the bottom half of the Indian population in terms of earnings. So it had been called a healthcare system for the poor, but it's going much beyond that. And of course, after that, we had the COVID crisis where everything was thrown helter skelter, and I think we coped with that quite well. And I think all the players involved, whether it's the government, whether it's the health tech startups, the hospitals, the healthcare system, they have really performed admirably. And I think we are on the path of universal health tech. So to discuss this important topic, we have with us Shuchita Gupta, co-founder of careforparents.in. Well,
Hello.
yeah, welcome, Shuchita.
Thank you, Sunil.
Yeah.
Happy to
And
be here.
yeah, great. And we also have with us Hardat Nanda, Associate Director, Saveo HealthTech. Welcome, Hardat.
Hi, it's a pleasure to be here. Thanks
Yeah.
for having me.
Yeah. So I think I'll just begin by maybe I'd like to know about your companies. Like, what are your companies doing? And maybe if you can just give a brief introduction about you.
Sure. So, careforparents.in actually is an endeavor to provide all healthcare services at one point through technology and at-home services. To one, to reduce the burden on the hospitals, and secondly, to just make it more accessible and easier for people while promoting preventive healthcare. And so we have medical history online. We give real-time access to family members of the digital platform where they can see the actual digitized prescriptions and lab reports. We have access to general physicians 24/7, access to ambulance services 24/7 through our app. And we digitize reports and do trend analysis from multiple lab reports, irrespective of which lab they belong to. And we also fetch data from wearable devices and non-wearable devices, so that all health related information is in one place, whether it's your insurance, whether it's your sleep, steps, lab reports, prescriptions, everything.
Hey, hi everyone. I am Hardat. So I'm a part of the Saveo team. Saveo is a B2B e-commerce platform for pharmacies. But before talking about Saveo, let me give you some context of how important a pharmacy role is in terms of delivering healthcare. So 85 to 90% of the medicines sold in India in retail takes place through pharmacies. That is not online, not through chains, right? So plus COVID, what we realized as the team members, that out of 10 prescriptions, 6 prescriptions were filled at a pharmacy store. So there was a huge gap when it comes to prescription fill rate. That is where Savio comes in. We are a multi-category, full stack e-commerce platform where a pharmacy can shop any kind of medicines. We have like the largest range of medicines across categories, that is ethical, Ayurveda, homeopathy, OTC, surgicals. And along with it, our logistic intelligence is so developed that we are able to deliver urban centers at 3 times a day and beyond urban centers daily. So essentially, based on these two capabilities, we are able to solve for those fill rate gaps and striving towards 100% of prescription fill rate at pharmacies. Moreover, like pharmacies are more distributed in this country, if I have to say, in terms of penetration into the country in tier 2, 3 plus rural areas. So that is where we kind of want to empower the pharmacies with all the tech and digital features, for instance, expiry management in terms of their procurement, and then grants in towards the front end for the pharmacies. So that's about Savio. It's a 3-year-old startup. We recently got a funding round, and yeah, that's about us.
Yeah, so I think like coming to the Ayushman Bharat Yojana, so I just like to hear like from the industry, from the startup point of view, what do you think of it? How do you think it's faring? So maybe if you think it's doing well, what are the benefits of the system?
Yeah, so if I may go first.
Sure.
So, see, the primary objective of the Ayushman Bharat Yojana was to decrease the out of pocket expenses that an individual does on health. And I think in that respect, it has been super successful. The latest reports in March, as they were released, showed a drastic decline in the out of pocket expenses that individual citizens were doing on health. Apart from that, whatever small hiccups that PMJ has seen in terms of implementation is being filled through the Ayushman Bharat's ABDM, because the digital platform is enabling, it is making hospitals more efficient, it is trying to fill the gap. I mean, we are about 1 million doctors short in this country, so it's trying to fill that gap where digitally you can connect a doctor to the patient who's seeking some treatment. It's about making data and treatment portable. I mean, if I'm even traveling in between any cities in India, if I relocate, my data or my treatment should not get hampered or affected. And that is what this digital platform is enabling, which is the success. Not only that, I mean, how many people could afford an insurance cover of 5 lakhs per family without having to pay premium? I mean, they're not paying any premium right now. So the numbers that we are talking about, crores and crores of people having access to that healthcare, I think it's amazing because earlier people could not, and I think spending on health is actually one top three reasons why people either remain or become subject to abject poverty. So if the Ayushman Bharat Yojana is able to do so much, and out of pocket expenses come down, and then you're not taking loans, and then you can prevent yourself from actually going into that kind of poverty. I think it's a really big success. That's what I have to say briefly about it.
Yeah, in my opinion, I think Suchita pointed out a big point, that is out of pocket expenses. I think in one of the years, I think before COVID, I think 40 to 50 million people kind of are so vulnerable that if they go for a healthcare treatment, they fall into the move beyond below the poverty line. So that is one of the key solutions that the Ayushman Bharat complete Yojana has provided. But before that, like, let me take a step back and kind of talk about this Ayushman Bharat in its completely, right. So Ayushman Bharat is comprised of mainly four pillars, if I have to say. For instance, one is everyone knows about the Jan Arogya Yojana, which is essentially 5 lakh of coverage for the uh, means below means 40% in the bottom rung of the social economic status, providing them 5 lakh of coverage irrespective of age, gender, etc., right. Other than that, there's health and wellness center, because if you happen to see, India's primary, secondary and tertiary healthcare system is not as strong to kind of cater to the remoter areas. So that is where the government has taken up an initiative of building around, I think, 1.5 lakhs of health and wellness centers by the end of this year. I think out of which they have completed 80% of health HWCs. Right. The third and the fourth, which is still not very dominant, I think the Ayushman Bharat Digital Mission, which has recently come up to kind of create that universal health identity number, similar to like the fintech wave. I think this will kind of uh, give way to the health tech wave in India. And the fourth, which is least heard of, I think, is the Mantri Ayushman Bharat Health Infrastructure Mission, kind of empowering the existing infrastructure in hospitals and healthcare centers to kind of be at a level to service the complete population in the country, or at least the ones covered. So, having said that, in terms of benefits, I think the biggest challenge I would think, is here the state and the center coming together and rolling out this Ayushman Bharat Jan Arogya Yojana, because as far as I remember, 60% of the fund is basically provided by the center, 40% is provided by the state. And India being such a diverse nation, most, I think, around 33 states and union territories out of 36 are enrolled into this program, which is a big win for the country. And I think that is the first step. And secondly, I think the government is layering on its kind of features, for instance, increasing the number of procedures under Ayushman Bharat, even including transgenders into Ayushman Bharat Jan Arogya Yojana. So, and kind of making it more favorable towards women and children, and especially the older people. So, in a sense, I think it has paved, or it is a good initiative by the government to take or make India more a more developed healthcare nation.
If I'll just add to that, recently, National Health Authority celebrated 4 years of PMJ, which is Jan Arogya Yojana, and 1 year of ABDM. And if you go through the kind of discussions that happened over 2 days during that celebration, it's very clear that the one incentive that the government has is that healthcare should be accessible, healthcare should be quality, and healthcare should be financially, there should be financial protection for people using healthcare. So I think government is very smartly trying to cover all three aspects: accessibility through digitization, financial protection is one is through the Jan Arogya Yojana, which is insurance of 5 lakhs per family, but also the e-rupee that was launched. So that voucher actually generates a QR code, and the user does not need any app, not even the UPI app or the Bheem API or anything to use that voucher. And all that person, that QR code comes on the mobile phone, and all they have to do is show that QR code, and they can have access to their treatment at the hospital. The hospital can just scan that QR code and get the payment. They can even get their medicines, because all these schemes are not only about treatment, they're also a little bit about preventive and access to medicines. So the financial bit is taken care through that. And about patients being at the center of everything. So again, the whole, I think, concept of digitization is so that data is not only available to authorities, data is also available to the patients so that they get engaged in their own care. And I think there are a lot of lessons that we've learned after COVID, some of them being that we probably need the minimum amount of information to give somebody healthcare. We don't need like 30 fields to be filled. I mean, COVID was asking for what? Your name, Aadhaar number, and your time slot probably, and that's it. And I think it's been a huge success. So that minimum data set that is required, that has been identified. And like Hardat pointed out, everything is digitized. It's not like things are not digitized. Before UPI happened, it's not like banks were operating all on paper. They had their digital backends. Hotel booking, travel booking, air ticket booking, individually, all the systems were digitized. They were happening on technology. But then, yes, one common layer on top of them has made it far easier. Instead of sitting in a travel agent's office who's checking his computer, through these multi-purpose apps, I'm able to check as an individual the tickets that are available, the hotels that are available across these digital platforms. And much like what UPI has done for all payment platforms. So whether it's banks, whether it's wallets, it's just a common infrastructure. So as far as health is concerned, that is what the government is again trying to do, is have that common layer of infrastructure, technology infrastructure, which can then enable you to find doctors, you to get your treatments, and like I said, interoperability and portability of data and treatment.
So that sounds quite interesting. I'd like to maybe expand on that, because not many people are aware of this. Like Aadhaar is the biggest like identity scheme, democratic identity scheme. I mean, China has also made great progress, but it's a dictatorship. So if you look at democracies, then I think Aadhaar is one of the biggest thing of its kind. It's been a great success. I mean, after that, PAN card, UPI, even for your personal things like e-commerce, digital. I mean, everything has been digitized and it's been made convenient. But still, not many people are aware of this Ayushman Bharat digital mission and the universal ID. So, do you think this also, though on paper it sounds great, practically, do you think this also can be a game changer? And will we see the universal ID, health universal ID, maybe as successful as Aadhaar, PAN, UPI? What are the things going for it? And maybe what are the things which we have to take note of that it should succeed?
Hardat, you want to say, or either ways?
Yeah, you can
Okay.
start.
So, Sunil, I feel that yes, it's going to be a game changer, but I think looking at our democracy, the way it works, looking at apprehensions right now that people and systems may have about spending then time and effort on digitization, it's probably going to be a slower process than what we would have liked or expected. And that's why it's optional right now. It's not been made mandatory by the government. But I think if we get our three pillars right in terms of the legal pillar, that if somebody is using my data without my consent, what action can I take? My security pillar, that how secure is my data? And third is the consent framework, that only if I give consent for the purpose and the person who can see my data, it should be made available. Otherwise, it should not be made available. If we can take care of these three pillars, that should invoke confidence in citizens, because finally, the stakeholder who is going to make this mission successful is only the citizen and citizen alone. Again, we've seen through examples from other countries, like Australia, they earlier had an opt-in system, which means like much like ours, that you have the option. If you feel like, you opt in. And didn't have many enrollments. But then the moment they changed it to an opt-out system, which means that uh, everybody by default is signed in onto the system. But yes, if you don't feel like, you can opt out. Suddenly, the enrollments went up, and nobody's really complaining, and rather people are happy about it. And if you look at other countries like Korea, like Hong Kong, everybody has this common platform where hospitals and labs are talking to each other, where there's a single patient health record. Because right now in India, you just see, I have one record with a lab, I have one record with a doctor, and I have one record with the hospital, which could be my discharge summary. And then I'm not even getting into devices right now, which could be my smartwatch, my BP device, my blood sugar device, and then my health insurance, another pillar. All these systems are not talking to each other. Now, if I have to take quantum leaps in the quality of diagnosis and healthcare that has to be provided with interoperability and portability, then all these things have to talk to each other. And again, why should I, as a citizen, have to again prove that I am Shuchita Gupta? I mean, I sign up on Aadhaar, prove it once. Then I sign up on Abha ID or ABDM, I prove it again. Then I sign up on insurance, I prove it again. If just imagine all these systems were to talk to each other, at least my basic data in terms of my name, address, phone number, email ID can be shared across systems also. I mean, I'm talking about probably phase 2 now, but I think as a citizen, it'll make my life easier. And like I said, if my legal framework and security framework is taken care of, because right now the debate on Aadhaar also seems to be about privacy. Actually, it's not about privacy, it's about security, and security will definitely take more importance over privacy.
So I kind of completely agree with Suchita, but I just take a step back here and kind of let's think of how the fintech wave of the UPI ID creation took place, right? So it all started with payments. So it was payments was something like a day-to-day affair for anyone in the whole country. And I would say the whole UPI thing or UPification was basically driven through stealth, I will say. For instance, whenever someone uses payment, which is very obvious, that becomes a normal behavior, like using your QR code scanner and paying. But then when the regulatory body kind of came up with this, okay, there should be an identification for every payee, and that is where the UPI came in, right? So essentially we were kind of stealthily taught how to use our UPI. through Beam or through the bank UPS, right? And then now they have started to talk to each other. So I feel like in my opinion, again, it's my opinion, ki there should be some way how this universal health ID creation can be taken place, and this has to be kind of uh, weaved into something which is very common in a day-to-day life. I understand health is not very common, or going for a healthy consultation is not very common. But how can we weave this into a system which already exists in the whole in the country, right? For instance, I think recently the blood donation campaign has been Rakt Kosh, I think, has been launched by the government, which could be a good way to kind of capture this information or kind of start generating universal health IDs for these patients, sorry, for the people of the country. So similar such steps needs to be taken to kind of create that UHID. And secondly, I think in terms of different systems and our data sitting in silos, I think that has to be kind of weaved, means an infrastructure needs to be created so that the systems in silos right now can start talking to each other, can be mapped to that universal health record or ID, so that it in the end of the day it actually saves cost. Because I see it this way, because as Suchita mentioned a case, right? I go to D1, I am diagnosed with something. After a year, I go to D2, doctor 2. I again have to repeat my history, etc., etc. It costs me time. It costs me more tests. It costs me maybe like there may be an error because there's some data missing from my previous diagnosis, not in the second diagnosis. So everything comes at a cost, and this cost can completely be reduced or eliminated if these systems and data records are kept in one place. And the third thing, I think, data privacy. Again, it's again a you get something at some cost, right? So that is always a arguable or kind of debated topic. But I find it very ironical because most of the world or the country right now is in TikToks telling the people, "Hey, look at me," and they want to share the data about themselves, right? So maybe like this is in terms of humanitarian leaves for better research. Maybe this could be a free way, like privacy could be maybe not a big concern here. But again, this is my opinion. Maybe like privacy laws could be relaxed at first and then kind of stringent later, so that at least we get this thing rolling and have a UHID, which essentially will save cost of not only the patient but also may help us in researching better disease profiles and drugs in India.
See, digitization through this Yojana, where essentially it is going to benefit the individual citizen, just look at what it can do later. So, digitization is also about what this data collected can do for you later. So, in terms of disaster management, anonymized data can be used to see how it's affecting a particular population in a particular geographical area, and then what kind of relief is required. Again, AIs can be done, so with consent, and if people allow their data to be shared in terms of the research of a particular disease, in terms of a particular virus, in terms of a vaccination that is being developed. So I think we all agree that data is key to anything and everything these days, right? But yes, health is something very, very sensitive. And so where people have already had apprehensions, even signing up to Aadhaar, I would say health, we'll probably see a little more resistance. And that's why we have to make sure that security and consent artifacts are really airtight in terms of the health data being shared across platforms.
No, so I don't know. I mean, then is this an impossible task? Because like if you look at Aadhaar, it is by and large, fixed data like address, name, and it is easily changeable data. And that is the same with even numbers. So the bank numbers are great. They have been crunching such huge numbers and changing numbers for the last few centuries. But when you look at the healthcare system, I mean, there is the issue of X-rays, there's CT scans, there are electronic health records, EMRs. Then there is private hospital. Sometimes you go to a government hospital. Prescriptions. Most of the data isn't digitized. All your prescriptions aren't digitized. They are not read, and it is more sensitive. So I don't know. It seems huge, more complex. Do you think we can overcome? Is there any country which we can look to Because I mean, all others in comparison, Aadhaar, UPI, PAN, everything has been a spectacular success. But this appears to be, like it appears like 100 UPIs or 100 PAN, all mishmashed with each other. So, is there any hope? Is there any country we can look to? So, just looking at from a layman's point of view.
Maybe I think in scale, I think there's no other country like India. I mean, this problem is very unique to India when it comes to scale and the complexities in India. But I think you answered like the question. There was the answer. Like since we have done it with PAN, since we have done it with
Yeah.
Aadhaar, right?
Yeah.
There's always a way. I think like just thinking on top of my mind, maybe like we can connect it with some of our vitals and kind of that helps us in generating a universal health ID, which is very true to myself, which can't be means it can't be changed, right? So that is something we can come up with. And I think with the advent of cryptos and the whole concept of decentralization through cryptos, there could be a way here where we kind of create these IDs individually and immutable IDs rather.
In my opinion, there are a lot of other countries we can look up to, and the good thing is that all the concerned people, whether it's Ministry of Electronics and IT, MIT, or whether it's the Ministry of Family Welfare, or whether it's the National Health Authority, they are consulting extensively with many countries outside India and trying to learn and adapt. Because, like Hardat said, we are a very different country with the and if we are successful, this is going to be the largest health ecosystem in the world. So we have already made a quick list from one of the standards, international standards called SNOMED. And SNOMED has been extensively implemented in Australia. Australia has other principles also, which they call 606, which is the basic principles, and then there's HL7 and IHE. But like I said, we have to see what is applicable to us and adapt to it. The good thing is that the Commonwealth countries are also looking up to India. So all the Commonwealth countries' health ministers meet very regularly, and they all agree that a lot of their citizens come to India for specialized care, so secondary and tertiary care, because quality healthcare is what is available to them in India. So they are actually looking up to India of how we can have portable data, continuum of care for these citizens even when they go back to their country. And so they are also helping us in all the way possible of how it can be digitized, how it can be secure. And like I shared, we have other examples from Korea, we have other examples from Hong Kong. And the good thing is all the representatives from these countries, UK, Hong Kong, Korea, Australia, they were all part of these 2-day deliberations that happened on the celebration of the 4 years of PMJ and 1 year of ABDM on this last weekend on Sunday and Monday. And it was amazing how they were sharing both their success and failure points so that we can learn from their mistakes and yet try and adapt to what they've done right. One of the things that this gentleman from Hong Kong shared was that what they did was they had a very simple and easy to implement basic framework for the backend. Like you mentioned that smaller hospitals, whether it's government or private hospitals, single practitioners, one doctor sitting in his home-based clinic, they may not have the wherewithal to actually digitize their backend systems and then implement all this to be able to associate with ABHA ID and upload it on a common architecture framework that is going to be built. Government is already working on this common minimum basic implementation that is to happen. They even have their certified service providers mentioned on the sandbox website there, where you can approach these people and they're going to help you on a very subsidized rate kind of a thing. But what this Hong Kong person shared was that they have made it like an open source code, which is very, very easy to implement. But again, maybe Hong Kong, where each and every person still has one technology person to implement that open code for them. In India, yes, that situation may differ, where we can not expect that individual doctors or these small hospitals may probably even have access to that. And so that's where I think NHA is working a little differently and has created this quick list of SNOMED that is to be implemented by everybody. Sorry. And so it's becoming easier, and they've also, like I said, maintained a list of the service providers which can help these people implement the same.
So another thing I was thinking is all health tech, all technology, and this Ayushman Bharat. Can we like finally have like a last mile connectivity? Can all rural areas be connected? Because I mean, healthcare is one very touchy topic. Because even you look at US, it's the world superpower, but even there, universal healthcare is an issue. So, can we have like universal health tech care? Because one good thing about technology is, through AI, you can scale up, the diagnosis can become faster. And in India, we used to be plagued by paperwork, but digitization and apps and all, it can, bring down. So like we are short by 1 million doctors, but maybe AI can become more efficient. The current doctors can become more efficient. So I mean, can we like can rural areas avail? Because like I know a lot of middle class people talk, but if you have health insurance and the best hospitals, it's quite easy for us actually, though we speak. But I think the real problem is with the rural areas. So I mean, through technology, how can we touch the last mile connectivity?
Yes, I think we can. Oh, sorry, Hardat, go on.
So essentially, I think I would rather say it's all about the distribution, right? So how distributed are the health providers or health providing centers are in the country? For instance, right now, as you said, doctors or like, for instance, let's take the rural people in the pivot, right? So essentially, a rural person can, for preventive or like primary care, they can go to the primary care, or they have to travel to cities or maybe urban metros to kind of get treated in a tertiary care center, right? Moreover, they lack access to doctors, because if I have to say, like, uh, the doctors are more concentrated towards the tier 1 or urban centers as compared to the tier 2 plus or rural areas. So having said that, I think we need to sort out our distribution, kind of increase our primary health centers. I think one of the yojanas under Ayushman Bharat, which is building up on those health and wellness centers, can be very instrumental. I think telemedicine will play a big role, because this solves the problem of access to doctors, right? Which is kind of a primary concern for the patient sitting in rural areas. I think around a crore plus of telemedicine consultations have occurred in the health and wellness centers in the last year. So I think that is something that can help the rural areas to kind of connect to doctors sitting in maybe urban or tier 1 cities, if not available in tier 2, right? And thirdly, like, we strongly believe in Saveo kind of empowering the existing entity that provides maybe healthcare, not healthcare, but medicines, maybe for instance pharmacies are well distributed throughout the country, right? Can we kind of make them or transform them from a mere drug dispensing entity to a more kind of, or empower their role, maybe kind of install a telemedicine kiosk at that uh, pharmacy, or maybe kind of help them, or in kind of, I think most of the pharmacies are B Farm. In fact, all pharmacies are required to be B Farm or D Farm, right? So they have some level of knowledge. Can we keep updating them on to kind of help the patient with any preventive methods? Because in when it comes to preventive, there could be kind of highlighting some symptoms of diabetes, which can help the patient to start the telemedicine or go to a particular doctor, which at times is absent at this point of time. So that is my thought. Like, we need to build a distribution system to reach out to the rural medicines. And of course, like, we can do means we can have these AI layers and maybe augmented reality, which kind of gives a real time experience for that patient sitting in rural area with that doctor, and try can understand like how does the medicine impact the whole body, kind of teaching, because half of the disease is cured when you are convinced that the therapy will work. So that is a very important thing when it comes to AI, AR. But the key thing I feel is first distribution, and then we can layer it on with tech and maybe entities sitting or near the rural areas.
So, in my opinion, like I said earlier, also the government, different government departments are working in sync, which is a good thing. So, at the anniversary, fourth anniversary of PMJ, Mr. Ashwani, the Minister of MeitY, was there, and he said that high speed or fiber optic cable will be laid out in every village in the country in the next few years, because he understands that if Ayushman Bharat Yojana has to be successful, if there is no internet connectivity in the rural areas, then it's obviously just a dream on paper and nothing is really going to happen. So if we have high fiber optic connectivity, then everything that we are thinking of in terms of digital infrastructure, in terms of apps built innovatively on top of this common architecture, will be available to each and everybody in the rural area, which also means that they will not only have access to preventive healthcare, they can also have access to specialized healthcare, to specialists like cardiologist, oncologist, nephrologist, and so on and so forth. They can even take a second opinion, because like Hardat said, every time I go to a specialist, he says, okay, no, I need the latest report, so can you get these tests again? But if I can use the same tests within a span of, say, 7 days, 10 days, and show it to another doctor for a second opinion, because I don't have to travel a distance to reach that doctor from whom I want a second opinion, then, the quality of diagnosis, I am convinced of what the doctor has said, and so then that will happen. And then the only travel which is probably required from the customers end or the citizens end is to finally get that treatment. And before that, everything can be enabled either through this one primary healthcare center which is there in his village town, which is going to be connected, or even just through his mobile app, which he can again use to discover doctors, discover clinics, discover hospitals. So yes, right now, in Ayushman Bharat Yojana, where the sign up of private hospitals to government hospitals is probably similar in terms of 50-50, maybe just 54-46 kind of a thing. But yes, the use of private hospitals right now is much more, only because of the reason that the government hospitals are sometimes ill equipped to handle multi-speciality treatments, to handle super speciality treatments. So yes, from that angle, the government has to start working on equipping the primary health centers, equipping the government hospitals, small or big, so that people can also start accessing them. Because again, it has to be a public-private partnership. So we cannot expect government only to be opening lakh more hospitals across the country. We cannot expect private only to be opening only lakh plus hospitals across the country. It has to be a joint effort, because there is a huge gap. There's so much of ground to be covered. But if we do it right, and if we do it in sync, like I said, different departments, different ministries together, I think it's definitely possible. And it just, so, I mean, again, like I said, at Care for Parents, we are doing fetching this data, from devices. We are digitizing lab reports, and we are enabling graphical representation of a test results across lab reports, irrespective of which lab it goes to. Now, we are now working with the National Health Authority to make this innovation, or this digital framework, work on the ABDM framework. Now, so which means that as a citizen, whether he is in a village or a town, if two different labs upload two different reports against the same ABHA ID, which this person is going to have, a graphical representation not only makes it easier for him to view and analyze his health, but also makes it easier for the doctor to view and analyze. And so, it's like how you first gather the data, which is the framework and the ABHA ID. Then secondly is how you use the data, like I said, both at the citizen level and then at the national level. And that's why data collection is very important, because without data, really nothing can be done, even at the individual level. I mean, at the national level, though, hardly anything is possible.
So then I'd like to ask both of you then, has there been any change in the data collection and the data crunching? I mean, in the last few years, have the health tech industry or the government changed the way, or is still most of the data in silos and unstructured? What have been the innovations in, I'd say, collecting data, digitizing data, and analyzing data, which have happened maybe in the private sector among health tech and which can be adopted by the government?
So again,
Any?
like I said, that we are working on it, and we are calling that vertical health Setu being the bridge. So we are trying to create a bridge between different silos where all these datas are lying, and so uh, it's so yes, on the private sector, definitely has been a change in way data is collected, in which the data is stored, and the way in which analysis can be done on the data. Uh, Also, a lot of government tenders are actually going out to digitize the government hospitals backend to make them ABDM compliant. Because, like I said, that's a common architecture. Whatever you do has to be in such a way that the two systems talk to each other, the hospital system and the ABDM system. So, a lot is happening across states. Rather, the National Health Authority and the Ministry of Home and Family Welfare even came out with a reward system where each district, each state, each department in each state was awarded for the maximum enrollments, creation of ABA IDs, for maximum digitization of records in a 50-day period from 1st August to 20th September. And, when there's a reward system, people feel encouraged to do it. So, I think that we are learning, we are innovating. Private sector doesn't need so much of a reward system. They're happy innovating and then building on top of the system in the hope that tomorrow it can become more useful and more usable. But on the government side, again, this reward system really works. I think we've seen through past, and so that is what the government is doing. So I think through the combination of the things that we are doing, because again, you see what one doctor makes out of a particular data, that should not undergo a change when that same data is shown to a second doctor. So again, the National Health Authority is working on the interpretation of data. So one is the minimum set of data required. So if I'm a hypertension patient, you don't need to know my last vaccination, for example. So what is the minimum data set required if I'm a hypertension patient? What is the minimum data set required if I'm a diabetic, and so on and so forth? One, they're working on that. Second is then of how continuum of care can happen. So if I am a hypertension patient, I've shown to doctor 1 and then doctor 2. So how the data has to be interpreted, what are those markers which have to remain constant across the medical infrastructure, across the health facilities. Uh, and then, it's like, because we don't have to lose sight of the end objective here, which is to give quality healthcare. We don't want to confuse the patient. Technology is only the enabler, not the end all and be all. And again, to make, sorry, I forgot to mention earlier, again, to make it easier for people to claim insurance money. The National Health Authority has launched the HCX, which is the Health Claim Exchange. Because we all know insurance claims used to be a manual exercise, non-digital, a very laborious exercise. There was no transparency. There was a lot of scope for frauds. So now with this health exchange, health claims exchange, everything is going to be transparent. It will probably even reduce the cost of insurance in the future, and it will make the whole system quicker, transparent, and easier for people. So, similarly, same thing has to be replicated for health. And so the government, like I said, is already working on that data set, uh, so that you have a common infrastructure for consent, you have a common infrastructure for even rating.
Yeah, I think Shuchita covered means covered all the points. Yeah, but I just want to add a few pointers here. Like if you have to imagine the whole data scenario, it's about supply, collection, and the usage of it, which was discussed about, right? So in terms of supply, I think the startups have to, I think the private players rather, have to play a pivotal role when it comes to data collection. Let's say, for instance, if you go to a telemedicine app, they kind of capture your vitals or maybe like height or normal features, right, and kind of capture all the data. B, then there are startups like who are kind of capturing your medicine usage, right? For instance, the e-pharmacies, right? They, once you subscribe to their, let's say, chronic medicine, they know like at what routines you need that medicine, if it's going up or down in terms of dosage, etc. So I think data is being was being collected and is being collected at a greater volume today. I think the whole problem would be to kind of weave this into one master database so that it's kind of usable by the data users, for instance the doctors or hospitals or maybe the research institutes, right? And that is, I think, still being worked upon. And in terms of data usage, I think privacy, as Suchita mentioned, right, there has to be some layer of privacy so that not anyone or everyone can access this collected data. So I think that is something that the government will have to work upon.
So another thing which like both of you have talked about in the last 15-20 minutes is preventive. So I mean preventive technology is also very important to reduce the load on the healthcare. So maybe you can speak about that, like wearables. If in cities we wear wearables, it can predict something. Then in rural areas, if you have telemedicine, and if they have at least someone to talk to and test them, they'll know the onset of diseases. And even when it comes to like something like COVID pandemic, I mean, if the entire world's healthcare system anonymized was on a system, it could predict the onset of all pandemics and all. So maybe if you can talk a bit about preventive, what you are doing and how it can be integrated.
So see, in India, unfortunately, we have lost this whole layer of general physician, which used to be our first go-to doctor, and he used to be like a family physician who knew your family history in terms of the hereditary diseases or what you could be prone to. He knew your personal medical history because he's seen you for years and years. And I don't know, somehow, yes, like I said, in India, that had gone missing. So through Care for Parents, first of all, we were trying to bridge that gap. So we have general physicians on our rolls who proactively call each customer every month, if not more, to again maintain that ongoing medical history. What is your vitals like? Blood sugar, blood pressure, everything. So that if something goes haywire, the general physician can identify. And we've had many case studies now where we've had early detection of symptoms only because they were talking to our general physicians regularly, and we could avoid sudden hospitalizations. They could be admitted to the best of the best hospitals because they were able to travel, and it was not like the 11th hour where you have to do with the doctor or the hospital which is right there. So preventive is very important. And now that we have integrated it with devices, so it's like for metro areas where we are using these smart wearable watches or other devices, it's like, suppose both my parents are diabetic, and so I'm prone to having that disease early on compared to anybody else. So now if my smartwatch is synced to the app and the doctor can see how many steps I'm walking, and suddenly the doctor notices that my average number of steps per week is going down, and my last lab report shows maybe a slightly increasing trend towards being pre-diabetic, he immediately picks up the phone and calls me and says, what is the reason? Why has your average number of steps gone down? And if I just say it's been work, then he'll probably try and sensitize me about what are the downsides, how I have to make it happen, or even if it's less half an hour of sleep but half an hour of walk, because even my last lab report shows an increasing trend. So that's how you tie data, which were earlier lying in different silos. But if I just say I'm feeling lazy, suddenly he'll probably raise a red flag in his mind, and he'll say, okay, you know what, Suchita, I think you need to get 1 2 3 tests done. and come back to me as soon as these tests are done. And again, all the lab reports are uploaded on the platform, digitized, the doctor sees it immediately, and he can take immediate action if an action is required. If he feels something is go haywire, he decides whether I need to show to an endocrinologist or whether I need to show to a cardiologist, because I don't know. I mean, symptom of being lazy, feeling lethargic could be anything. It can be to do with liver, it can to do with stomach, it can be to do with sugar, it can be to do with heart, it could be anything. And unfortunately, I can't decipher who to go to. It's like, maybe I'll go to a cardiologist because some friend said I think you should go, and because such and such happened also to mine, this known person. And what if the cardiologist gives me again this plethora of tests, MRI, ECG, Holter, etc., etc., and finally it comes out to nothing, and then I go to a second specialist. Whereas this general physician who understands my history, who understands my data, will probably point me to the right specialty doctor in the first instance itself. So that's what we are trying to do through Care for Parents. That's what we are trying to now even help others through Health Setu, where we have this plug and play offering. You don't need to again start working on it from scratch, just for a small license fee. Please use our plug and play software and just connect to all labs and devices. So it's open for all hospitals, it's open for all healthcare apps also, because I think there is really no room for competition, rather a lot of room for collaboration as far as healthcare is concerned in our country.
So, in my opinion, I think this whole problem of, let's say, the preventive healthcare, right, is different when you are at an urban center or when you are at a rural center, right. For an urban center, there are plethora of options to kind of go to and get yourselves maybe checked up. Whereas in rural areas, the other point that you guys, I think, mentioned, Suchita mentioned, like the doctors, essentially in older, means not even in today, like you rely on certain set doctors or family doctors where you can reach out and ask, hey, I'm feeling thirsty or I'm losing weight, which could be a potential symptom for diabetes. So if you are at an urban center near a doctor or near a hospital or a tertiary secondary care center, you are at a relative luxury than a rural counterpart. Now, when I go to the rural area, right, maybe there's not, maybe there's a Kabiraj, not a doctor available. Or maybe, I think what we have learned from 3 years of operations, right, pharmacies kind of play that middle role in terms of advocating for a certain treatment. So that is where I think, and which we are also working upon through our continuous medical education program for the pharmacies, where we kind of keep on kind of updating the pharmacies. For instance, if a pharmacy sees a person who has lost weight, who is feeling thirsty, who's feeling hungry nowadays, maybe blurry vision, means instead of just giving them an ORS because they're thirsty or dehydration, or maybe like they can refer the person to a particular doctor. Or that is where I think our another layer of telemedicine can come in for the pharmacies itself, because in a rural setting, the doctor patient relationship that is very strong in in urban centers becomes relatively stronger in rural areas, means the pharmacy patient relationship. And that is where I think Saveo is kind of trying to, through its CME program, make the pharmacies more responsible and kind of advocate the right instructions to the patient, so that they can seek better treatment rather than ill-informed treatment, and which may be like have adverse effects on them.
I'll just add to that. So in rural, I think what is required is one is information sharing, and secondly, sensitization towards these different symptoms. So a lot of content needs to be created for rural centers, for rural citizens, number one. Number two, so again, we have customers across 89 cities in the country as Care for Parents. So people who are living in tier 2, tier 3 cities are connected to our doctor through the mobile app. And the case studies that I'm talking about, some of them are actually about tier 2, tier 3 towns. And that's why I said, that they did not require sudden hospitalization. They could travel to a metro center because their kids felt that they're going to get better quality healthcare there. Not only that, we are trying to do sensitization and information sharing at our level, where we have monthly webinars through different specialists every month. So one month we'll talk about spinal cord and the back pain for elderly and others. Other month we'll talk about diabetes. So in diabetes, one is about the symptoms and what you should do, and then another session could be on the recipes that you could make, which could be friendly for your kind of condition, whether it's hypertension or diabetes. And then again, we've had talks 1 month then from an orthopedic, then 1 month from a cardiologist, because a lot of times there is just simple lack of information, or just sometimes I think we forget something. It's like, yes, we had heard it, and then at that point, critical time where we probably needed it, it just slipped our mind. So when you keep revisiting such information regularly, it stays at the top of your mind, and then you can use it. And the small tips that the specialists give in the webinars are very, very useful, because everybody makes one common point across all webinars, is that first reaction, first response has to happen right at the home itself where you are undergoing that symptom. And if that happens right, you've actually bought yourself some time to go to the hospital or the doctor. But if you've not done that right, whether even if it's a small burn, then it could just be disastrous. So as far as rural is also concerned, I think one is definitely connecting doctors through apps and in digital infrastructure, but I think a lot of content has to be created to just share and sensitize them as far as different conditions and diseases are concerned.
Yeah, anyway, thank you for all that detailed thing. I think we are almost out of time. So while going, I'd like to ask you, what do you think is the one big game changer that's going to transform the Indian healthcare system? It could be any technology solution, AI, variables, data, anything. I mean, what in your view is?
I would say innovation on top of this common digital infrastructure that the government is making is going to be that one game changer.
Hardat,
So in my opinion, I think building those pipelines right to the heart or the remotest areas of the country, be it through technology, be it through, let's say, a simple medicine, talking to a patient, improving the patient assistance and adherence and providing information. So essentially building those pipelines, building a good distribution network, because yes, patient, we all the healthcare is centered around patient, all the policies are centered around patients, but do we have the means to kind of take it to them? So essentially it could be through tech, it could be through supply chain operations, or maybe through mobile, but there should be a solid distribution pipeline, in terms of ideation, innovation, and to execution, so that the patient benefits at the end of the day.
yeah.
Well, let's not
So
forget that today most of the India uses some wallet or the other, and so
yeah.
if they can do that, they can definitely do a lot more with their phones.
Yes.
So anyway, thank you. It was very engrossing, and actually, it's been a pleasure because I really enjoyed talking to professionals like you. Because I mean, COVID. There was a time when I think entire India was under depression, and what's going to happen. But it's surprising the amount of technology solutions. I mean, most of you, I talk to you, talk not in terms of like 10 years back, this is a problem, that problem. But now all of you talk of these are the technologies, these are the solutions. So I really enjoy listening to all that. I'm very hopeful that we're going to come out of this and give last mile connectivity. So it's really been great talking to you. Thanks.
Thank you, Sunil. Thank you, Hardat.
Thanks, Sunil, for having us. Thanks, Shuchita. Nice meeting you.
Bye.
Bye bye.